Hello, today we're going to talk about the pandemic's devastating impact on healthcare workers. Who one of y'all are healthcare workers? Thank you, by the way, for your service. The Guardian and Kaiser Health News found that the number of U.S. healthcare workers that died during the pandemic is considerably higher than official figures released by the government. Now, the HEROES Act that was proposed before the stimulus that we just got right now had in there was specifically geared towards healthcare workers because they're putting their lives on the line in helping other people and putting themselves in danger. With that said, thank you very much, healthcare workers. 2,921 deaths among healthcare workers up to December 23rd, 2020. That's just last month, compared to 928 deaths reported by the Centers for Disease Control and Prevention as of September or December the 17th. So the agency has stated that its figures are likely an undercount. More than half of the nearly 3,000 deaths in the Guardian in this study, KHN analysis, involved people under 60. Median age of death from COVID-19 in the general population is 78. By that, it is just 59 among the medical staff on the front lines of the pandemic. 680 deaths were counted in New York and New Jersey, the early hotspots of the pandemic. I think that's where the flare up with the the retirement home or something like that, a nursing home. I think a lot of folks died there. While the toll has been climbing more recently in western and southern U.S. states. 2 in 3 deceased healthcare workers were people of color. I know a lot of us are familiar with what that means, but I found it interesting because don't we all have color? I guess if we don't have color, then we're dead, right? While a large share of those who died had serious concerns about inadequate PPE. What is PPE? Personal protective equipment. So I guess that's like masks and gloves and stuff like that. One in 3 deaths involved nurses, with 420 cases identified. Thank you, nurses. Thank you all, hospital staff, administration, doctors, and everyone else that's involved in taking care of those among us who are sick. Other healthcare workers listed are first responders, like ambulance, probably, maybe firefighters, social workers, cleaners, and culinary staff. And here is the final bar chart that you probably all have been waiting for. What can we glean from this? Well, a lot of us look at hospitals as a safe haven. You can drop off your kids there if you don't want them anymore, like a baby, no questions asked. And they would, but a lot of times we kind of forget that hospitals are also a place where you can catch a lot of diseases and germs. And so being careful with our hands, touching things whenever we go to the hospital, and I guess that's why they don't let very many people go in the hospital. I've heard of cases where there's people that had a loved one. In fact, one of my cousins was dying, but no one was allowed to go back there to visit him because of the possible spread of the virus. Support personnel, thank you very much. I guess those are all the certified nurses, assistant, and all the other technicians, physicians. Thank you very much. First responders, administrative technologists, diagnostic clinician, social workers. I guess that's where I would be categorized at. Cleaners, other, culinary, and I can barely see that, security. Thank you very much. This disease has had a toll on all of us, and I'm glad that we are finally getting out of this stage because we have vaccines that boast a 95% ability of that 95%. What was I trying to say? 95% working rate or something like that, where it actually works 95% of the time. To all those who continue to be on the front lines, thank you very much. I can't say enough for all the hard work that you do and have done and will do in the future. If you like this video, please subscribe, hit that like button, and also if you feel inclined to comment, please comment because I answer all of them. Thank you very much, and I hope y'all keep safe.